Hello, my name is Leanna Tower, and today I will be teaching you about electrocardiograms. These are also known as ECGs or EKGs. So, first I'm going to tell you what the purpose of an ECG is. An ECG is going to monitor and record electrical activity in your heart. This is usually done by placing electrodes around your body, and they have lead wires connecting them to a device that's going to record that electrical activity so that a doctor or other provider can look at it. So these are useful for a few different reasons. They help to show the heart rate, the heart rhythm, and the timing of different impulses in the heart. So they can help to diagnose certain heart conditions and monitor treatments for heart conditions as well. So if you have a heart condition and you're either on a medication or you have an implant such as a pacemaker, then a doctor or provider can look at an ECG and say, hey, this isn't working. We need to change it a little bit. This is not working at all. We need to go a different route, or this is working perfectly fine and we should stay this course. This can also just help to assess the overall health of a patient. So a few different things. So this is what an ECG is going to look like. This is completely normal rhythm. This is what you would call sinus rhythm, because this is what the ideal would look like. Not everyone's is going to look like this. Everybody's heart is a little different. So if it doesn't look like this, it's not necessarily something to be concerned about, because there are many different variations. There are a few to be concerned about, and a provider can tell you what those look like, and there are some that are going to be fatal and that require immediate medical intervention, such as VTAC and VFib, so ventricular tachycardia and ventricular fibrillation. So let me dive into what each of these parts means. So this is a P wave, this is a T wave, and then this is called your QRS complex. So the P wave, the PQ interval, which is from the start of the P wave to the Q, right down there, that shows your atria contracting. So the top of your heart right here is going to be pushing that blood from the atria into the ventricles. And there's a short pause here so that the blood can fully go into the ventricles before the valves close. All right, and then this QRS complex right here, that is going to be the top of your heart. So the atria are going to relax while the bottom of your heart, just down here, is going to start to contract. So when part of the heart is contracting, that's called depolarization, and when it's relaxing, that's called repolarization. So while the top of your heart, your atria is repolarizing, then the bottom is starting depolarization. So it's going to start to push that blood up and out. Now, this ST segment right here, that is the full depolarization, so the full contraction of the ventricles, getting all of that blood up and out of the body, or out of the heart, my bad, up and out of the heart, so into the lungs or into the rest of the body to be distributed and supply nutrients. So the T wave is actually going to be the bottom of your heart starting to relax. So you're all done, and the bottom is going to start relaxing, and then the rest of the ventricle is going to relax as well, so that the blood can be squeezed back into it from the atriums. So an ECG is very helpful to physicians. It can really help them to be able to see what's going on in your heart and know what they should do. Thank you very much.